A few minutes ago, you told me about the results that you had when you went to the eye doctor, and you are diabetic.
Yes, sir, I am.
And you've had problems controlling your blood sugar for how long?
Probably the last 2 years. Really, it's been jumping from like 330, and if I give myself a shot of insulin, it'll go down to 61 or so.
Which is too low.
Way too low, and yeah, I'm yo-yoing back and forth on that. Now it's steady. It's still a little high. It's running about 130, both in the morning and at night. So it's steady, maybe 2 or 3 points difference. But I'd like to get it down to about 120 or
right.
lower. And I cut my insulin down from 99 units in the morning, 97 at night, down to 15 units a day.
Wow, wonderful.
Beautiful.
Wonderful.
It saves you money, and plus it's really making me feel good.
And this is because you're on the ideal protein diet, correct?
Oh yes, sir. I'm not doing anything else. They changed my medicine a little for cholesterol, but they haven't changed anything on my sugar diabetes.
Right, and you're regulating it by changing the amount of insulin you got. Now,
yes,
you went to the eye doctor recently here. What condition were you in before you went? Last time you were there, how long ago was that?
About a month ago, and
this is before the diet.
Before I started the diet, it might have been 6 weeks, but he had told me to come back in 6 weeks, I guess it is, and that was yesterday, the 3rd of June, and he said, I'm going to have to use a laser on you when you come back on the 3rd of June, because your blood vessels are breaking, your hemorrhage in your small blood vessel.
In the eye, in the retina.
Which will make you lose your sight, so he says you're going to go blind if you don't do something. And then I went on a diet. I went back to 3rd of June, and he says, I don't believe you're the same patient that was in here earlier, the 6 months before. They did a lot of tests. They put dye in me on the 3rd, and he says, I'm not going to use the laser on you. All we're going to do is monitor, and you come back on the 22nd of September. We'll see how you're doing. He thought, and I said, he thought I was doing, putting something in my eye or something. He says, what are you doing? I says, nothing but dieting on this protein diet, which has really helped me.
Right. That's excellent. That's excellent. So basically the hemorrhaging or the bleeding in the small vessels of the eye and the retina have basically cleared up.
Yes, they have. I won't get some things back that he explained that I wouldn't get some of the things back I've already lost. Some of them deaden in your eye, I guess.
Right.
Blood vessels go bad, but he says as long as you stick with what you're doing, you will not
go blind.
You're blind, or your sight will not get worse.
Yes.
So I've got a brand new pair of glasses, and I don't wear them because my sight has actually gotten better. He says your sight has to be better. I says I'm not wearing my glasses.
That's excellent.
And I wore glasses for 12 years now. I can show these glasses I have on now are my old glasses. All I wear them for is when I cut the grass and something to protect my eye.
Right.
Because I'm so used to these old ones. But
yeah, that's excellent. Good job. Now, is it okay if we use this for educational purposes or to help people understand what is possible on the diet?
Yes, sir. You sure are.
Excellent. And if that ever changes, you let us know. All right.
Okay. Yeah. Well, yeah. I'll be back next week.
Okay.
Hopefully, I lose more weight. I'm glad I'm losing the fat.
Good. Good deal. Thank you very much.
Thank you, guys.